Welcome to this week's edition of Endocrinology Updates, covering the latest breakthroughs. Brought to you by LucidQuest. Mifepristone, traditionally known for its use in hypercortisolism, has shown promise in managing difficult-to-treat diabetes. Results from the Catalyst study revealed a 1.45% reduction in HbA1c, along with a noticeable decrease in waist circumference, even without substantial weight loss. Blood pressure outcomes varied depending on baseline values, but metabolic benefits were seen regardless of adrenal status. Gene therapy is gaining momentum. Genprex announced successful preclinical results for GPX002, a novel gene therapy that converts alpha cells into insulin-secreting beta-like cells. In non-human primates, glucose control improved for over 3 months. Temporary immunosuppression helped mitigate antiviral immune responses, signaling potential for future human trials. In rare endocrine disease news, Lu AG13909 has received Orphan drug designation for congenital adrenal hyperplasia. This first-in-class monoclonal antibody targets ACTH-driven hormonal imbalances. Phase 1 and 2 trials are underway across North America and Europe. Addressing the care gap in osteoporosis, a pilot program aimed at post-hip fracture patients significantly improved treatment engagement. Follow-up rates increased from just 10% to as high as 50%, and 42% of eligible patients accepted osteoporosis care referrals. A dedicated nurse navigator played a key role in bridging the treatment gap among high-risk elderly populations. On Capitol Hill, more than 170 young delegates participated in the Children's Congress, calling on lawmakers to renew the special diabetes program. Celebrity advocates joined the effort to spotlight type 1 diabetes research, cell therapy innovation, and the urgent need for continued funding. In the retail sector, Publix and Theracos Bio have partnered to provide access to affordable type 2 diabetes medication. Brenzavir, a once-daily SGLT2 inhibitor that lowers both A1C and fasting glucose, is now available at a discounted rate in over 1,400 Publix stores across the United States. Ireland marks a milestone with the launch of the first early-onset type 2 diabetes clinic in the Northwest. Located in Sligo at the Ben Bulben Care Hub, the clinic offers appointments within 2 weeks for patients under 40. Since opening, it has completed 45,000 visits and processed 10,000 referrals, providing a model for chronic disease management. In osteoporosis research, romosozumab has demonstrated superiority in a large-scale meta-analysis. Compared to placebo, alendronate, and teriparatide, romosozumab achieved greater bone mineral density gains and reduced vertebral fracture risk by up to 72%. Importantly, no significant cardiovascular safety concerns were observed. In women's health tech, Lilly Health has introduced an app designed specifically for managing PCOS by addressing its root cause, insulin resistance. The platform incorporates at-home insulin testing, personalized health tracking, and expert nutritional support, offering an alternative to one-size-fits-all lifestyle recommendations. Breakthroughs continue in regenerative medicine. Scientists have successfully 3D printed human islets capable of producing insulin. When implanted just beneath the skin, rather than in the liver, these islets retain structure and insulin function for over 3 weeks. The approach offers a minimally invasive and promising avenue for type 1 diabetes therapy. Finally, Biocon is expanding access to insulin across Southeast Asia. In Malaysia alone, the company has supplied more than 100 million insulin cartridges, serving over 345,000 patients since 2016. This effort is supported by a strong public-private partnership with the Ministry of Health and is anchored by Malaysia's first and largest integrated insulin manufacturing facility. Stay ahead in endocrinology research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.